Good afternoon, everybody, and welcome to today's Opioid Response Network webinar, Sustainability Ideas for RCOs During an Economic Crisis. Now, folks, we've got some really terrific presenters ready to go today, and we're going to get to them in just a couple of minutes. Please allow me to do just a little bit of housekeeping first, okay? Now, as I go to the next couple of slides, I'd like to pull up our very first poll here and let you respond while I continue on. One thing I do want to make sure everyone knows is that your participant phone lines are going to be muted throughout this entire presentation. And as we enter the Q&A portion, we'll unmute those phone lines, but we're going to tackle all of our queued questions that have been submitted in the chat during our presentations first, okay? So if you've got questions as you're listening today to the presenters, put them in the chat, and we're going to pull them out, and then we're going to work to answer as many of them as we can in our Q&A session. So let me get that poll pulled up, and I'm going to have you respond, and I'll share a little bit more about the Opioid Response Network. So the network itself it works with communities really to address the opioid crisis. And SAMHSA's State Targeted Response Technical Assistance, that's the STRTA, this was a grant created, the Opioid Response Network. And the whole goal was to assist STR grantees, individuals, and other organizations by providing the resources and the technical assistance they need locally. And that's the key, locally, to address the opioid crisis. The technical assistance is available to support the evidence-based prevention, treatment, and recovery of opioid use disorders. Next slide. All right, thank you. The ORN provides local experienced consultants in prevention, treatment, and recovery to communities and organizations, and they do that to help address this opioid crisis with a local perspective. The ORN accepts requests for education and training. So if you're interested at all you need to do is submit a request, give us a call. We'll be happy to brainstorm and talk you through the technical assistance needs. Each state and territory has a designated team. It's led by a regional technology transfer specialist, or a TTS. And that person is an expert in implementing evidence-based services. So to ask questions or submit a TA request, all you need to do is visit www.opioidresponsenetwork, all big one word, .org. You can email orn@aap.org. Or you can simply call 401-270-5900. And as I said earlier, we're happy to have a conversation. We'll help you think through the potential TA needs. You may even wonder if what you have as a need rises to technical assistance. We'll help you answer that. We'll work together with you to meet the needs of your community, your organization, your personal need. With that, we're about to move into this, the meat of this presentation. Let me talk a little bit about what the connection to the Opioid Response Network poll gave us. Melissa, can you give me the results of that poll? Fantastic. So when we look at who's here in the room with us, and that's really what we're hoping to do today, we've got about 9% are the TTSs themselves. I don't see any ORN recovery, treatment, or prevention consultant. Well, there is a prevention consultant, and there's about 9%. I don't have a number, so it's hard for me to say what 9% is. Is 9% 10 or is 9% 1,000? I suspect it's probably closer to 10. We also have the general consultants for ORN, again, around 9%. It's really cool to have or previous ORN technical recipients, technical assistance recipients on this. I love that. And we've got some staff members. This one's a fairly large, double. at 18%. This is staff members at an ORN partner organization. And it looks like others, that's a big 45% are just here for education, information, and for personal reasons. So I want to thank everybody for participating in this poll, and we're going to have one more poll today as we kind of move forward through the presentation. So, all right. So this is really what what folks are here for. We're really fortunate to have the presenters that we have today, and they're going to be talking through sustainability ideas for RCOs, and really through these times of economic uncertainty and crisis. So we're going to kick this event off with, honestly, these guys are just amazing. Kristen Harper. Kristen's a recovery specialist with C4 Innovations, and she's also the Project AMP implementation coordinator. We're going to move from Kristen to really the fabulous Felecia Pullen. Felecia is the executive director for Pillars in New York City. And last but certainly not least, we're going to hear from, honestly, I just think Robert's a rock star. So rock star Robert Ashford, and Robert is the executive director for Unity Recovery. Now, I'll turn this over to them in just a second, but before I do that, there's two things. I want to go over today's learning objectives with all of you. And at the same time, I'm going to pull up our final poll for today's session. And that poll is really to help me and the presenters find out what you all are hoping to gain as you participate in today's events. And these polls do help us determine who's in the room and what the expectations may be today. So please take a moment to complete that second poll by writing your responses right into the chat box, and then we'll review them just in a couple minutes. And as we move through this discussion, if you've got questions for the presenters, please remember to share them in the chat. We're going to work to address as many of them as possible in our allotted time. So here are the objectives for the session today. We're going to describe ways to diversify state and federal funding and the importance of developing relationships with policymakers. We'll look to identify other options for fundraising and establishing some revenue streams. We're going to look at some strategies to use outcome data to support the sustainability efforts and the market successes. And then we're going to talk a little bit about how to overcome funding losses and then pivot towards new partnerships and opportunities. So lots of good meaty stuff today. And what I'll do is, as we're looking at what people are hoping to get out of this, I'm looking to my tech team to let me know if we've got any responses, and we can continue moving on. As you're thinking about what you're hoping to get out of this today, don't hesitate. Just pop them into the chat, and we'll revisit this at a later point. Also remember, as the presenters are providing their presentations and sharing, any questions that any of you have, pop them in the chat. We'll do our best to get to them at the end of the presentation time. All right, so you've all heard enough from me, and you didn't come here for me. This is just the general reminder, questions in the chat, and with that, Kristen, will you kick us off today?
Thanks, Stephen. Greetings, everyone. It's a pleasure to be here. Thank you so much for the invitation. And I was just peeking at the participants in the room, and I think I've actually had the privilege and the opportunity to work with some of you. So I'm really excited to see some TTSs that I know and have worked with in the past, and actually may even use some of those TA requests that we've worked on as real-world examples as we move through the presentation and Q&A today. So my role here really is just to provide a very basic overview of recovery community organization structure. We also use the phrase peer-run organization, recovery community center, you may have heard. So for those of you that are not too familiar with the ins and outs of the recovery nonprofit world, what I wanted to do is just provide a very basic overview of the intersection between recovery practices and services with nonprofit management. I have to say, I absolutely love this topic, love it so much. We actually got a new initiative established through C4. We're doing an organizational development arm, and we're offering TA around nonprofit development specifically for RCOs and PROs, and extremely excited to be doing that work. As a former executive director of a national nonprofit and a statewide RCO in North Carolina, I have to say that it definitely takes more than passion. It definitely takes more than lived experience to be able to operate an RCO, an RCC, or PRO. And so when I kind of cut my teeth on the nonprofit world, oh gosh, almost 8 years ago, it just really opened up an entire new learning experience for me. And getting into nonprofit management really has been interesting, overwhelming at times. But when I look back on some of the mistakes that I made with these nonprofits that I was an ED for, I could link them directly to a nonprofit structural issue, more so than the recovery practices. So our two other presenters today are real world case examples. They're going to share what they're doing at their RCOs and how they're running their organizations. And so if you'll just allow me a little bit of time up front to kind of walk you through what it looks like from the inside, I think you'll be able to connect some of the basic framework to what they're going to share in just a little bit. So you'll see from this slide, there's a lot of different components that make up nonprofit management. This is just kind of my top 6 that we usually provide a lot of training and support. Board of directors, financial management. This would include working with a bookkeeper or CPA. Development and fundraising, and there is a difference between fund development and fundraising. We'll talk briefly about that in just a little bit. Marketing, promotion, staff development. Some people call this talent management, and then also community partnerships. The recovery practices, which I think most of you are probably either familiar with or are learning through the ORN network, really involves expertise in recovery support services. So we're seeing community-based centers open, we're seeing collegiate recovery organizations, recovery high schools, a lot of specialty programs with a focus on a certain population that are incorporating various types of recovery support services. Also, they all include some kind of nonprofit framework as well. Next slide, please. So just briefly, I think it's just helpful. I kind of use the 5 elements when I'm working with organizations around nonprofit development. We look at the elements and processes that affect nonprofit organizations and how they are effectively implementing their strategic plans, doing rapid assessments, those types of things. And so the following is a very brief checklist. Again, just a very brief overview of some of the fundamental components that you may want to include when you are considering doing some technical assistance for RCOs or PROs. Next slide, please. So the first one, clear and compelling vision. I think that, as a person in long-term recovery that has worked in the recovery field, I have to say that oftentimes, even though it would make sense that we would have a clear and compelling vision, sometimes we don't. Sometimes we get very caught up in a passion-driven, emotionally kind of based idea of we're going to change the world, we're going to save kids, save people, save families. And so taking a step back and really doing some strategic planning and doing some real work in developing a mission statement and your vision is a foundational component to building the nonprofit and the recovery services around a very clear and compelling vision. This will also help with funding. Obviously, if you have a clear purpose, clear mission, and it's compelling, you have amazing stories to share, I'm sure, then you want to make sure that you capture those and include them for future fund development. Next slide, please. So a passionate and engaged board of directors. This is one of my favorite areas to work in. So as you all know, board of directors serve as the governing body for nonprofits. And it's also come to find out through a lot of mistakes, there are identities, different identities for a group of board of directors. So we usually work with organizations around developing those identities. Are they going to be a working board? Are they a volunteer board? Are they going to be primarily a development board? And it's very clear it's very important to be clear about not only the mission of the organization, but also the mission of the board of directors. This can also help when you're developing expectations for your executive director and staff, and where's the overlap between the board of directors and the executive director. The nonprofit that I worked with in North Carolina, we had a phenomenal board. It's very balanced. We had a board chair who was very familiar with the recovery community, but also with business development and nonprofit management. So anytime that I had something come up as the executive director, I would immediately go to my chair, and the chair would help me problem solve, come up with solutions. Really, you want your board chair to be your biggest advocate as your executive director. So there's just a couple of examples here within. You may hear from Felecia and Robert on how they engage their board of directors and the different roles they may play later on. Next slide, please. Effective communications and marketing. This one is also really important. You want to make sure that your message is always concise and clear and consistent when it's going out. In the recovery realm, I'm sure you all know, we do have a lot of resources for recovery messaging. We have to watch out for propagating stigma with our language. And so we are constantly telling folks that we work with that we need to make sure that the language is consistent with the rest of the recovery movement and where we're trying to get to. Creating a strategic marketing plan. I usually like to do that after I've done some sort of local landscaping, trying to see who's out there, who are the decision makers in the community, who are we trying to reach, who's our audience, and we want to make sure that we're not using jargon because that will completely lose anybody that's just in the general public. So again, it depends on your marketing and who your audience is. You want to make sure that you're proactive with your messaging. I think Robert and Felecia do an excellent job of that, and you'll hear some great examples on this topic. Next slide, please. Strategic approaches for funding is a huge part of nonprofit, right? I think it's a misnomer, the name nonprofit. We all think that nonprofit means that we shouldn't be turning a profit. That's not entirely true, right? We need to have a profit so that we can stay open. So I think that it's important to know what is your bottom line. Understanding a strategic funding plan is critical. Understanding which programs are attached to which funding streams. Knowing how much money you need to raise per year, per quarter. Are you tracking that quarterly? So having a balanced portfolio of funding sources can be really, really critical, especially right now. We're seeing at state levels, especially with the COVID cuts, is what we're calling them. RCOs, RCCs, PROs are being directly impacted with state funding being cut. And so having a balanced portfolio, looking at different ways to bring in some additional funding sources is pretty critical right now. So we'll talk more about that in the Q&A, I'm sure. Next slide, please. And then finally, you want a motivated professional staff. And I mentioned briefly that you probably have heard the term talent management as well. Again, these programs, we bring very passionate, dedicated individuals either to volunteer positions or to staff positions, understanding what their roles are, clear expectations. Are you giving them enough support on the HR side? How are you developing that talent? And where are they going to go after they leave you? We often find, especially in the peer recovery support world, if they have been certified as peer specialists, there's kind of a wall that they hit. So how are you helping your staff stay motivated, feel supported, and feel like they've got a career within the recovery field? Also, I think that one of the things that we often talk about with nonprofit organizations is just understanding pay scale and attaching that potentially to grants or to other types of funding. That can be a little bit tricky. So that is the basic overview of nonprofits. And now I think we're going to welcome in Felecia and Robert. Felecia first, to give us some real world examples of the amazing work that they're doing. So I'm going to toss it over to Felecia.
Hi, Kristen. Thank you. And thanks, Stephen, for that great intro. I hope that I get a chance to live up to all of the things that you said about me in the beginning. And I'm really excited to be here because it's an opportunity to talk about how we've actualized some of the things that Kristen laid out in the beginning. And so I'm going to start with this beautiful logo that is in your upper left-hand corner of this first slide. And I started out when we were putting together the pillars is trying to figure out the best visual. Kristen laid out about the importance of marketing, and this is really our marketing tool. It is our voice in the community when I am not in the community, when our staff is not in the community, and our partners are not speaking about us, but others are seeing the logo. And so that logo is in 4 pieces for a reason. It talks about how individuals can use those services, and we needed, when we were building out the pillars, to come up with this strong icon that spoke to how will you care for yourself when you're in here, and that's the biggest part of that logo. How do we integrate the family component, which is the second piece right above that larger square, if you will, and then how do we focus on the community, and then finally the society as a whole. And so next slide, please. The way that we have integrated sustainability into the pillars model is really in a 4-point component. And so, of course, grants is the biggest piece and the largest part of how we make sure that there is a consistent stream of funding coming in. And how that's really manifested is amazing to me, because the Pillars was Manhattan's first state-funded recovery community and outreach center. And the reason why that is still mind-blowing to me is because the others that are downstate New York are all part of larger conglomerates. They all have treatment and they all have counseling attached to them, medically assisted treatment. But my vision was to really expose this community to some of the things that I experienced as a woman in recovery. And so my vision laid out on paper was enough. And I think that that's really important for people to know, is that your vision can be enough. I didn't need to be an Odyssey House or a Phoenix House or a Samaritan Village in order to receive the appropriate funding to open up the doors of the center. And that's something that I want to really bring across when I'm speaking to the audience here. The passion and the compassion was enough for the initial outlay of the vision. The data mining was important because once we opened the doors, we needed to know the who, what, where, when, and why. Who was coming through the doors? Why were they coming here? What services were important? Why were they selecting us over some of the other providers in the community? And then once we took a look at the data, we had to respond appropriately to what we were seeing. We knew that that meant we needed to increase some of the services that were popular and effective, and then we needed to decrease some of those that were not. And so that data mining was important for us to continue to go back to serve the people, because it was always, always about the people that were coming through the doors. And then finally, one of the things that we did with the grant funding is to make sure that we were looking at other opportunities for growth. We made sure that, yes, we were organic. We have a SAMHSA B Corps grant. So that was a brand new organic grant that we received this year. That is the Building Communities of Recovery grant. We are the only organization in the state of New York that has that grant. So that was very organic to our mission. But we also look for opportunities for growth. And so there are many grants that we have received and some that we have not, which speak to what is the 5-year vision and where do I want to go? So one of the opportunities that we have seized was a prevention grant. It's not within the sweet spot of recovery, but it is within the same vein of what we do at the Pillars. And so we opened up an opportunity for us to do prevention to ride along with the recovery. The last point is the fundraising, and I saw someone in the chat box just ask a little bit about that. And so this picture on the left-hand side is actually from our fundraising gala. What I was able to do was really to tap into relationships, and that's a reoccurring theme across everything that we do. And so the relationships that I tapped into were, I knew a musician and I called him. The gentleman in the beautiful hat is a comedian who is very well known. And so we use those large names to create a draw. But what I really want to say about this is that we were not, hugely financially successful when we had that fundraiser. We did not meet our goal of, $300,000. But what we did was to increase our awareness in the community. And there were some other things that grew out of that. There were some other new partnerships that grew out of that, that spoke to the sustainability piece. Next slide, please. So this is a great segue for me to talk about building on and using those partnerships to build on that SAMHSA model from the DFC and that prevention grant that we have. We made sure that we took that model, and I'm a woman in recovery, right? Go big or go home. And that has always been my approach. And so with the SAMHSA model, it asks that we have someone in the medical field. I don't believe in a person in the medical field. And so I brought in large institutional hospitals to fill that sector. Asking all of NYPD to participate with us when we do events, and that means, yes, I am connected with One Police Plaza. I am connected with the Chief of Community Affairs. I am connected with the Chief of Patrol. And so that allows me access to an institution that I may not have access to. And how we've leveraged that is we've had officers from the 28, 23, 32, 35, PSA 5, PSA 6 walk with us in the community to put 16,000 door hangers on individual apartment doors in 9 public housing developments. Those are the kinds of partnerships that really help us create the sustainability that we don't have just through the funding of grants. So we definitely believe in joining hands with other people who have the expertise to do what we do. I mentioned earlier about the fundraiser and how it did not help us meet our financial goal, but what it did help us do is the picture on the right to the left, sorry, I don't know if it's your right, but it's my left, is doctors from New York Institute of Technology's College of Osteopathic Medicine and medical students. So they were participating at the fundraiser. They happened to have enjoyed a wonderful evening and then said, how can we help? We ended up with an amazing partnership with them, whereas once a month they were on site doing medical exams for our members who may be insurance insecure or may not have insurance at all. Now that partnership has morphed into a telehealth partnership. And so these are the things that we did not have and could not afford if we were seeking to do some of these things on our own. Through partnerships, we get about $130,000 a year in in-kind donations, and really that's what helps us to increase sustainability. Next slide, please. Our volunteers are key to everything that we do. Thank goodness everything does not lie on my shoulders because I don't teach yoga. But what I am privy to are some amazing yoga instructors that love this community, that want to give back to this community. And that's the fourth part of the pillars. When anyone walks into the door on that logo, we ask them, what are your talents and how do you come back and give back in the form of volunteerism? We don't charge for anything that we do here, but we do believe that being a part of the community means that you have value and that you have something that you can come back and give back. We have had volunteers come back and clean our offices. We've had volunteers matter of fact, someone was changing a light bulb not more than 3 minutes ago. And so the volunteers do yoga, meditation, acupuncture, Reiki, and those are the services that we just don't have the ability to pay for, but we can offer the community because people come in and say that I believe in your mission and I want to give back. There is one thing that I do want to touch on because I know that we've each been impacted by COVID. And so because of our tight connection to the community, we had about 400 people coming in here per month pre-COVID. And we were heavily impacted, our community was heavily impacted by COVID. But what we were able to do is to use COVID as an opportunity to broaden our reach. And so I say that with some trepidation because it sounds like it may be a little, I don't know, coarse or callous. But what I will say is that COVID offered us an opportunity to do digital outreach that we just did not have. It offered us an opportunity to take everything online so that even when this is over, and I say when this is over because it will be over, we will continue with these telepractices that we didn't have before for people that just cannot, for whatever reason, get out of their homes. And so I'm grateful that it showed me where our gaps were in our business and how we could actually fill those gaps. So next slide. I am going to hand this over to, and I'm going to agree with Stephen, a rock star. This gentleman just has been so creative, and I've learned a few things in only the few short moments that I've had to speak with him. And so I'm going to do a warm handoff to Robert, who will talk to you a little bit about how he's been able to actualize sustainability on his side. Thank you.
Thank you, Felecia, and I'd have to say the feeling is very mutual. And what you're doing at Four Pillars, and hopefully something that we're continuing to learn from you and emulate here in Philadelphia as your RCO brethren to the south. So thank you for the presentation and the warm handoff and warm remarks. But good afternoon, and I think everybody's on the east or central coast, so no good mornings. But in case you are, and I missed you, good morning to you as well. My name is Robert Ashford, and I'm the executive director of a recovery community organization in Philadelphia, Pennsylvania. Next slide. So as I mentioned, we do consider ourselves an RCO. We are a hybrid RCO in that we don't just provide traditional peer recovery support services. For us, it's traditional, but perhaps to the larger context of RCOs around the country, a hybrid RCO also provides peer-based harm reduction services, which for us is part of the recovery continuum of care and included in recovery support services, but certainly can be a little different than traditional RCOs. We've been around for just about 2 years with a brick and mortar location that has been vacant and mostly digital over the last couple of months, really since March, but is doing really well, and we've been able to emulate most of those services. Generally, our service lines include a lot of similarities with Four Pillars, but our primary one is one-to-one peer services. We have always offered a branch of telerecovery services, especially in Philadelphia, where enhanced and increased poverty is really high. Transportation can be a barrier. Our public transportation is awful compared to other parts of the country, as well as childcare and employment and all of these other environmental and social barriers that can prevent engagement. So we've always provided telerecovery, though that's gotten much more pronounced recently. And those peer services are based on what we call a social determinants of recovery framework, which is more commonly known probably to many RCOs as recovery coaching. We also employ, in addition to our peer recovery support specialists, several family peer recovery support specialists that provide family services, which is both a combination of one-to-one recovery planning, even at the familiar or other loved one level, but also assistance with childcare, daycare especially, which has been more relevant to our members' recoveries that are impacted by COVID with their work in the more recent months, and a full range of family-based education workshops in all recovery meetings. We also do recovery yoga. My wife and I, when we started Unity a few years ago, our personal recovery had been very involved with and impacted by our yoga and meditation practice. So we work with another national nonprofit based in here in Philadelphia called Transformation Yoga Project to offer trauma-informed and recovery-centric yoga for free into our community. And we now offer those 5 times a week, in addition to other yoga classes and meditation classes. Of course, as an RCO, we offer a range of mutual aid support meetings or recovery meetings. Those include the one we host most often, which is All Recovery. So everybody can be in the same room with a variety of experiences and learn from each other. And then also the more common and perhaps traditional 12-step meetings of a range of types: Smart Recovery, Refuge Recovery, family meetings, grief support meetings for overdose survivors and those impacted. And then finally, we also offer a wide range of, again, what we call social determinants of recovery workshops, more commonly known as life skills workshops. So financial literacy, employment skills and education, daily living and routine, et cetera, et cetera. And we offer all of these also for free, which we'll talk about some of our diversified funding streams, but we do not do fee-for-service reimbursement. Anybody can come in, whether they have insurance, don't have insurance, the ability to pay, it's never even asked about. Everybody gets everything 100% for free at any given time, thanks to the funding levels we've had in place through various benefactors, which we'll talk about. And though hybrid also means what I had described before around offering both peer-based harm reduction services as part of our recovery support service offerings, the other part of hybrid by design is that element that we've always provided a range of digital engagement opportunities, as well as in the community and in our center. Though more recently, we've certainly been mostly digital due to COVID-19. Next slide. You have to press it one more time. Thank you. So similar to many of those that you might work with and other RCOs and recovery support institutions around the country, we did pivot to all digital beginning in the middle of March. Now, we were lucky that we had a lot of the infrastructure in place that could expand rapidly prior to COVID happening. We just needed to put everything online and emulate other in-person and community-based services, which meant we could scale up rapidly. And it also meant that we could begin to change some of our model, which has had funding impacts because our catchment area of who we can serve, the recoveries and family members and other loved ones, we no longer have borders. Thanks, luckily, to some gray areas in how telehealth and recovery services are classified as credentialed employees, we can cross state lines, especially in the digital context. So whether that's one-on-one services, online recovery meetings, recovery yoga, or life skills workshops, we no longer just serve Philadelphians. We've been serving people across the country and across the world for the last 6 months. But we couldn't do that alone. And I think that's so true both for our fundraising and business development efforts, but for all RCOs, this is a community. It's a bedrock of peer services. And for us, that has meant working with other national RCOs, SOS Recovery, the Alano Club, We Connect Health, Foundation for Recovery in Nevada, and others to make sure that our no borders recovery support services could be sustained and offered across time zone for a variety of populations. And it's thanks to that network, just like our community in Philadelphia, that we've been successful for the last 6 months, which has opened up the door to amazing opportunities, funding and otherwise. From a structural standpoint, to think of how all of this comes together, and it also gives you an insight into what we have to support from a financial standpoint and what we're fundraising for. We have 3 peer supervisors that do provide one-on-one individual supervision for all of their assigned peer specialists. That includes both families as well as traditional recovery support specialists. And in that breakdown, currently that's 12 CRSs, which is what we call peer specialists in Pennsylvania, and then 3 family recovery support specialists. We do operate 7 days a week. That is traditionally included a brick and mortar location of about 11 hours a day. That's fully remote and digital now, but it's still maintained 7 days a week. And we've actually increased the hours of operation for our peer recovery text line, which is not a crisis line, as well as one-to-one service scheduling for about 12 hours a day. And we continue to expand as funding comes in to hopefully get that to 24 hours in the foreseeable future. And then as our makeup from a funding, and it's not nearly as diversified as we would want, we are still heavily dependent, as many RCOs, on a mix of grants and contracts, as well as our board gifts and community giving. And that split breaks down to about an 80%, 10%, and 10% respectively. You know, the state funding through SOAR, support, STR, continuance, and expanded funding is primarily where we get most of our recovery support services funding today through the state of Pennsylvania. Excuse me, as well as private contracts with foundations, so the Independence Blue Cross Foundation, United Way, several to many other RCOs that allow us to provide those free services without needing to track or engage in fee-for-service reimbursement. As I mentioned before, we take none of those contracts. Primarily, that allows us to be more effective and providing more services without 25% of our staff time going to documentation, and invoicing for fee-for-service reimbursement for peer services. We also, with intention, our board is both a slightly practice-based board, meaning they work, but primarily we've curated a board that gives. That's both primarily independently, so from their own wealth and resources and talents, but also securing outside gifts as part of their annual pledge to our organization. So for us, all of our board members give $10,000 a year at minimum. Some will give more, which allows us to have a larger split in overall funding. And then we do have community giving, which we leverage a high intake of community giving through social media, but also end of year giving campaigns similar to many organizations that exist within the nonprofit space. Again, our target is closer to a 60-30-10 split, but we're certainly not there yet, which impacts the way that we operate in the business development and diversified funding opportunities that we go after. Next slide. So I'm going to kick it back to Stephen. My slides kept short, and hopefully we're going to have a really robust Q&A to answer many of your questions and provide more insight into all of our work in the day and hopefully provide some useful information. But without further ado, I'll give it to Stephen to start the Q&A portion. May need to unmute Stephen, our tech support team.
My apologies. It sometimes takes a minute for my team in Boston to unmute me so I can unmute myself. So apologies. And we'll dive in because I do have a number of questions. And one of the first things, before I even get into those questions, there was a comment in the chat box, and it is around, bear with me, it had to do with logic models. And there's an individual asking about, she states that she's currently working on a logic model for recovery support services, and she's hoping that anyone would be able to share their own logic model. And she's also looking for some existing program evaluation plans and data collection tools. If folks have any examples about this, or could share anything, just let Michelle know in the chat, and I think she would be very, very happy to get anything that folks might be able to offer. So thank you for that. And let me just dive in. The very first question, I'm basically going to throw this out to the presenters. The presenters will respond, and I'll follow up to just check in with each presenter, make sure that there's nothing else that they'd like to add, and then we'll move on. So the very first question is this: what do you see in the future as it relates to diversifying services and approach in order to continue pursuing innovation? Examples might be data collection, technology, etc. Somebody want to respond to that?
Sure, I'm happy to take a crack at it, and I think everybody could also add some great elucidation to this. But it's interesting, and I think the field was already moving this direction. In addition to my work at Unity, I'm what we call a recovery scientist, and I've published about 40 different papers on recovery support services and recovery support institutions. And while a lot of that has been on language and stigmas, as several of you that know me know that fact, but a lot of it has also been on digital recovery support services, which by its very nature has the context that it requires technology to be delivered. And we saw an increasing use of these digital technology tools, whether it be they smartphone applications, leveraging things like contingency management. WeConnect is a good example. Social network sites that are specific for people in recovery, SoberGrid would be an example for those. They were being used at about 10 to 11% of the population of people in recovery, looking at the National Recovery Study, but that number is likely, and preliminary data would suggest, has ballooned dramatically, 40 to 60% amongst the recovery community because of COVID. And though it was happening anyway, this was essentially an accelerant, exponential increase in the way that people were using these tools, and the opportunity to leverage those technologies, not only to continue to provide services with continuity, which means that your grant funding isn't impacted because you're still meeting your deliverables, you're still engaging the amount in populations that you said you would. You're just using a different way of doing it. Those tools already exist. It's just they are much more commonplace today. And people in recovery that may have been on the fence of even wanting to use them have been somewhat forced to over the last 6 months, though that depends on the part of the country you're in. So I think it's incumbent upon us, and the RCOs especially, to leverage new technology, because it allows you not only to continue, again, continuity of services, but opens up a whole nother arena of service delivery in the future. Whether that's engaging people in a lower threshold manner, engaging with populations that are often are not seen, not that they're hard to reach, which I think is a kind of a misplaced term, right? They're exactly easy to reach if you know how to reach them and engage with communities, but it allows us to engage on their terms in a way that we don't have to predict on our own policies and procedures or limited bandwidth and resources. Because technology also means that we can do more, oftentimes with the same amount of money, which nobody perhaps wants to hear, but it does provide a compelling narrative when you're writing grant applications. The other part I would add on data collection as both a recovery scientist and the executive director of an RCO is using some type of tool that is built for our workflow and RCO's workflow and peer services is critical. And there's two primary in the field today. One is Recovery Link, which we use at Unity Recovery. It's an electronic recovery record that mirrors and was built by peers and people in recovery that work at RCOs. Allows for data collection, custom reporting. It streamlines the administrative burden. So again, you can do more with the same amount of resources, but also helps making sure proving efficacy of what you do to your funders and other stakeholders. The other opportunity in individual or organization and platform in this space is Recovery Data Platform from Faces and Voices of Recovery that enables several of the same key elements with some differences. But I think those two facets, the big picture and the takeaway there, because that was a lot of words, right? I'm very verbose, is using technology, whether it is to enhance and engage people or to supplement the administrative work of your organization, will mean that we can serve more and probably for the same amount of money, but really what it's going to enable is going out to get more money to do more and better work. Technology is not going away, and it's going to exist in both service lines, how we serve people and how we collect that data, and we need to get on board at a much faster rate as a field.
You know, I always look to Robert because I'm a dinosaur. I admit I'm a dinosaur. Technology is not my love. But it is very key to what we do. And so there are entry points to data collection that I have found that have demystified a lot of this world for me. So for example, when individuals walk into our space, we have something called the receptionist. And the receptionist mirrors what the state asks us to collect in terms of data. And so we were able to configure it. It is the demographics, you know, from race to gender to sexual orientation, ethnicity, but it also asks, why are you here? And so it's really simple, it's easy. They control the entry and the input, the data entry. And then what we do on the back end is that we'll pull a report every month. It mirrors exactly the report that the state asks me to give them. And all I have to do is really transfer from one place to another. But I don't want to give up paper either, because there are a lot of people in my center who are seniors. We have individuals that are coming in that are 50, 60, 70 plus that are not really comfortable with a digital platform. And so our perception of care survey is still on paper, and they will take it, they will sit in a quiet space, and that allows them to tell us how they feel about the services that they're receiving in the center. We then have someone, and so it's a little bit of a duplication, but we then have someone who will put that into the portal that the state will then take a look and see how we are serving the individuals that are coming in. So, and then the third piece that I wanted to add to what Robert is saying is that Salesforce is also a platform that allows us to do many things with ease. Again, I'm a dinosaur, I'm an old woman. I don't want to learn a lot of new technology, but it is user-friendly and it's easy for me to know who came in, what was said to them, and then what happened after we had the conversation. So I'm not as techie as Robert is, so I'm gonna tap his coattails and learn a little bit from him. And here are some other ways paper still works.
Thanks, Felecia. That, you know, I don't think you can call yourself a dinosaur. I really don't, because you're just so innovative. And, you know, if you all listen to what both presenters just gave as examples, what you hear is that they're leveraging their strengths in both of their communities. And regardless of where you are, your technology knowledge or the capability you have to implement, you know, high-level research tools, taking a look at your strengths, doing some assessment on your organization on a fairly regular basis can be very helpful, especially when you move into innovation planning. It's critical to know what assets you have at your fingertips, as well as what you're missing. And those missing components, those gaps, again, when you're trying to diversify funds, big piece of that, relationship building. And that's the number one thing you said, Felecia, earlier on when you were talking about your fundraiser. It wasn't necessarily about the fundraiser, right? It was about the relationships that you're cultivating and building. Robert is one of the best relationship builders I've had the honor of working with for the past 10 years. And so I think that every successful RCO, PRO in this space really understands the importance of leveraging their assets and understanding how to move forward strategically.
I don't even know what to say. I mean, those were all three just fantastic answers and responses, and thank you all for that. One of the things that I want to follow up on, and this is specifically to Robert and something he stated in the introduction to his presentation, and the commenter said this, Robert. You were speaking of providing services with no borders, and then I thought I heard you mention that you are now able to do so legally. I may have misunderstood you, but are there legal issues with providing services virtually to someone outside of your home state?
So, and I'll expand on, because I had given a brief answer in the chat, but I think it warrants conversation, especially for those organizations and RCOs that are billing Medicaid, since Medicare hasn't changed yet, but there is a proposed bill that will make them eligible. But in Medicaid populations, you can have fee-for-service eligible reimbursements for eligible services. And the way that the telehealth, telemedicine, telepsychiatry, CMS guidelines are written, which would include what we consider telerecovery, which is providing our services through digital means. The way it's written is that licensed professionals can't provide services outside of the bounds of their licensed state unless they have a reciprocity agreement within the state that what we would call recovery, in their case, patient, is in. But the way that it is written, peer specialists aren't actually covered under the current guidelines and regulatory framework because we're not licensed professionals. We're certified paraprofessionals. And the professionals and paraprofessionals distinction doesn't matter. The certification versus licensure does. So if you are a non-fee-for-service CMS billing entity, there is no implication. It's not illegal or non-legal because the regulatory framework applies for what is eligible for reimbursement and what is the sound way to do and provide those services under that framework. So it's not that we became legal to do it, because we also aren't fee for service, but we do try to hold to the highest standards, which would include the CMS guideline as one of those, even though it's specific to reimbursement. Again, because of the way it's written, it does not apply to peer services. So all RCOs, unless they change the regulatory framework or guidelines, can operate and provide digital recovery support services through technological means, including video and audio and other HIPAA and Part 2 approved methods, without running afoul of those. Again, I will preface this, I'm not a lawyer. I don't pretend to be one. That is our read and interpretation with our counsel at Unity around how that framework exists. But it wasn't a question of becoming legal. It's that the gray framework of that CMS guideline does not apply to peer specialist services. The other thing I'll add as an aside, mainly because I'd like to, and I can because I have the mic, is that we don't provide services virtually. We're not at a place in time, not yet anyway in our field, that we have virtual reality, fully immersive and ingrained environments that people can engage with their peer, or a mutual aid meeting, or take a recovery yoga in a headset or a holograph all around them. It's really pertinent that we describe things, I think, as they are, so that we can continue and hopefully get virtual services one day, but we really have digital services. Just as y'all are engaging and watching me in this presentation on a screen, we can do that with digital recovery supports, but we can't put people in an immersive environment yet. We would need a lot more funding and a lot more advancement to do that. A little bit nitpicky, but I just want to make sure if we call something virtual now, it may mean we don't have innovation for the future.
And this is why I said I'm a dinosaur, right?
But what a fantastic response, Robert, and really helps clarify. I mean, I'm just looking in the chat. Michelle is like, okay, that absolutely makes sense. And it is an interesting difference between digital versus virtual, and words matter. They matter. So I think your point is spot on, and thank you for that really comprehensive response. So let me ask you, this was an audience question or a participant question, I'm sorry, but are any of you billing Medicaid? And in addition to that, can you just share a little about the types of grants that you actually do apply for?
I'll take the type of grant question, and then I'm going to pass over to Robert because we do not bill Medicaid. We apply for what makes sense for the organization and for the community. So that means initially we applied to SAMHSA for a drug-free communities grant to do prevention work. We broadened it and we applied to the Office of Alcohol, well, it's now Addiction Services and Supports, to open a recovery center. We have a Building Communities of Recovery grant, again, through SAMHSA. So most of our grants, and Robert spoke to this earlier, most of our grants are federal and are state. But we also know that the Manhattan Borough President every year releases funding to support whether it's infrastructure, or if you get 3 years of $50,000 in grant funding from the city, you can then have access to $2 million of city funding, so that can be used to purchase a building. And so what we do know is that there are many pockets of funding that other people may not have their eye on. We know that New York State Economic Development Corp helps us to do some workforce development. And those are grants that are not, are always coming across our email lists, but because of the relationships that we have with those LGUs, we're able to access the funding. But we don't do any Medicaid billing at all, not even for our peer services. And so that's a growth area for us. That's a 5-year plan for us. But right now we're still mining the lower hanging grants that are out there.
Yeah, I think we're in I think it's a very similar framework, right? We have an actual policy at the board level that we will not do fee-for-service reimbursement, which would include CMS, Medicaid, and structured private payer, whether that's through a single county authority, block grant contracts with a pass-through entity, or through any other mechanism. Like, we won't engage with those because of the impact they have on our workforce, and their quality of life is just as important to me as the community that we serve. And if we can't commit to doing it well, meaning 25% or more of their time is spent doing invoicing, or we have to spend resources to enable that, it's just not sustainable or a path we wanted to go down. I will say, with a caveat, we continue to look for and advocate for capitated payment models through Medicaid and other types of insurers that we would take. And we certainly can talk through in another webinar the difference between general fee-for-service at unit billing versus capitated payments and others. It's a very convoluted hodgepodge of our mixed payer healthcare system in the United States, but we don't do that either, is my point. What I will say in terms of what we go after, so we go after anything and everything that fits within our mission. And though mission creep can be a real thing, especially when going after funding, we take a much more kind of broader view that there is things that may not exist directively within our mission today that we want to expand into. So we always look at, is it in our mission today, or is it something our community has asked us to encompass for the future? So while we don't take a hardline stance to mission creep, it does allow us to think about how we can go after more grant opportunities, always through the litmus test of, is this serving our primary stakeholder, which is the community the individuals in or seeking recovery from behavioral health disorders, their family and friends and other loved ones, as well as business stakeholders and other community stakeholders that are impacted by the work we do, whether through primary means or tertiary means. And I think the other opportunity I would give, because I think it's important, it's helped us from our administrative burden, is if you are a 501c3, sign up for TechSoup, which is in partnership with Google. Once you're verified, you can get a whole bunch of stuff at nonprofit rates. And once a year, they give and have, it's actually going on or just went on, so we'll have it this time next year, is a significant discount on Grants Station, which is a software as a service platform that has just about every foundation and grant opportunity you could ever imagine, eligibility requirements, you can set up keyword searches, but we find so many of our opportunities from that mechanism at almost a 90% discount, thanks to being a nonprofit through TechSoup, that I would encourage everybody to get and have, whether it's, you don't even need a business development person, anybody can set up alerts and use that to augment until you have the resources to have a fully fledged kind of grant seeking development person. You know, the last piece I would say, and Kristen mentioned this before, is relationships. So before I can even find most RFAs and RFPs for new grants, somebody has sent them to me, and I can't understate the value of relationships, because when people know what you do and the quality and caliber of work you do, they'll send you opportunities to expand your funding. And that's always been, we've had so many opportunities that we've gotten and several that we've lost that have come through a personal connection that says, hey, saw this, thought you'd be a good fit. And that should be a primary strategy as you're trying to find new grants. But I think the question in chat too was around, do you go after healthcare or this or that? We go after everything, right? If it touches recovery, which is a broad, holistic lens, we're going for it.
Thanks, Robert. I just wanted to add quickly that I think one of the things that I learned in North Carolina, we were awarded the Access to Recovery grant, the last cycle of it before it unfortunately died out. It was a wonderful program, but it was $8 million over several years, which sounds amazing, right? $8 million, who doesn't want $8 million to do recovery support services? But because it was tied directly to the state SSA, we had somebody that was responsible for oversight and for grant management. There was a lot of burden placed on our staff to do invoicing and manage the different financial streams we had. And so I think just understanding that if you do get big money, there's going to be big responsibilities attached to it. And so weighing the return on investment of something like that, I think, can be really, really important. The other thing I'll add too, the opposite of that, is if you have been in a really comfortable place with funding, which is not super common with us, but if you have, and then a contract goes away or funding gets cut, the first initial kind of gut reaction is to lay off staff and go after more funding, right? Bring in more money, layoffs, cut your cost. Well, that can cause something called compression, which means that the staff that is left is overworked, will become burnout, and you have not moved forward strategically with your funding options. And so if you are looking at budget cuts, I strongly recommend taking a look at strategically cutting staff that won't harm the staff. I love what Robert said, that quality of life is just as important for staff as it are the people that we serve. And I think that compression is a real issue right now, and people are reacting instead of really taking a moment to think through it. And I think that that's a mistake for down the road.
You know, I'd also like to add, Kristen, I love what you just said about not cutting staff. We don't do everything in-house because we just don't have the bandwidth to do that. And so we subcontract out our accounting, our HR. And so that alleviates a lot of the burnout on our side with our staff, and does offer that quality of life that keeps coming up because it's important.
Fantastic, folks. And I have to say, Robert, there was a point where you were talking about the different, kind of financing mechanisms and how convoluted they can become. And I had that, that momentary eye glaze start to happen, because those are complex issues, and it's challenging to do them and to even, converse around them if you don't have sort of an understanding and a background, and recognize how critical, both funding and data are for the organization. The funding to, keep the organization's doors open, and, the data to show the funders that you're actually doing the work that is required to keep the doors open. So And all three of you really just had, I had several questions as you all were kind of going through each one of your pieces, and you answered them just in your responses. So thank you all three for really some fantastic responses. I'm gonna pitch a softball here. How can an organization figure out when they're in trouble? And how do you come back from something like that?
That's a softball. We were talking a little bit offline in all transparency, and so one of the questions that I posed in response to that question is, how are you defining trouble? And so, trouble can mean my lease is running out and I don't have a new space yet. Trouble can mean my grants are running out and I don't know how I'm going to maintain the staff in order to serve the community. And so one of the things that I think is key is to understand, how are we defining trouble? And so I will pose that back to, and I would love to see a little bit of communication back from the audience as to how are they defining trouble? What do they think trouble means? So that can help to answer some of those questions more directly of how they're seeing and defining trouble.
That's a really great question. When you've identified that trouble is ahead and you can see it coming and you don't know what to do about it and it's just coming and you've tried everything, that's the worst feeling in the entire world. And I think that some of the early indicators, especially at the nonprofit that I worked for, we started having some breakdown within the board mission and philosophy, right? And so the board became split. That's often something we see in a lot of nonprofits. A recent TA actually just did with Sherry, who I think is on the call, up in Wisconsin or somewhere, I don't remember, but a recent one was there was a nonprofit, their board basically had split into two different boards and they hadn't even identified that as actually happening. And so just understanding that any kind of turmoil that's happening at the board level or within the staff, it's definitely time to do some kind of organizational assessment and really pinpoint, is it a funding issue? Is it a staffing issue? Is it a philosophy or mission drift issue? And then moving forward after you've assessed what the trouble is. We can all feel it. We know when the climate has when it shifts in an organization, and just taking a step back as leadership and trying to really kind of pinpoint the areas that need some attention, that's usually what we recommend.
So I welcome Felicia's comments for audience participation, and as we're waiting on some of that potentially to come into the chat, yeah, I'll be somewhat, I'm going to say it's funny, but it's more of like an ironic, like, I don't want to cry, but don't get into trouble, right? Like, whatever that may mean, avoid it completely, because that's the realm that we live in. But that's certainly not the case, right? So whether it's financial trouble, the goal is to have staff that are dedicated to doing that, right? And as the executive director, that's primarily my role, is to help avoid trouble by utilizing the resources we have. So I spend 90% of my time writing grant applications, building relationships, and avoiding financial troubles. But it certainly will continue to happen. It's part of the organizational struggles of a nonprofit. And then other types of trouble require, in my mind, being proactive instead of reactive, which means, at least in my life, having a great team that really makes all of the stuff possible. So having an RSS director, multiple directors and peer supervisors, doing great professional development with your peer team or other staff, making sure to give them more PTO than perhaps they got anywhere else, paying them a living wage, not relying on all of the things that we treat our staff poorly, right? All of our staff and their mentality, their well-being is indicative of trouble coming down the pipeline. We can do so much as leaders of RCOs and other organizations to just do the right thing and treat people how we want to be treated. That helps us resolve that trouble. Yes, it requires resources, but it's paid dividends that I'm glad paying 10 to 15% more in costs to make sure our people are taken care of, to avoid that trouble coming down the road.
Wow, honestly, that was a spectacular answer, Robert. The idea of treating people with a livable wage and the respect and dignity, and that all of us really want and reach for. But is so often uncommon outside of our world. And it's one of the reasons when I say our world, I'm thinking about, the recovery world and those of us who, have come at that with peer status. This entire conversation has been fantastic. And we are just about out of time. I've got a number of additional questions that I'm just really sorry we can't get to, because the responses have been fantastic. And I know that the information that's being provided is going to be useful, not only for the TTSs that are here on this call, but for everyone that they're going to come in contact with, and particularly around folks who are, looking at how do I keep my organization's doors open. I love the comment about just staying true to your mission. That is beyond true. And what I want to share with the rest of the audience is, aside from a massive thank you to the presenters here today, we are in October. We've got 3 more events coming. In October 20th, we've got Increasing Racial Equity in Recovery Supports. That will have Joe Powell, Ashley Stewart, and Daryl McGraw, all, again, more rock stars. I'll be moderating that event as well. And I'm really looking forward to that discussion. If we can go to that next slide, 2 more. In November, we're going to be working on developing the peer workforce through training, internships, and job placement. And then in December, just a few days after my 61st birthday, we're going to look at reimbursement for peer support services through Medicaid. So all the topics will have, I think, really important information for TTSs and those folks who are working with organizations and individuals that are supporting those of us with behavioral health challenges. So again, a massive thank you to the presenters here today. And I hope all of you have a fantastic Tuesday afternoon, and will join us in October. Everybody have a fantastic day, and thank you again.
Thanks, everyone.